2/3 of the world live in places where clinicians have no imaging to make the right decisions about treatment.
In West Africa, there are fewer trained radiologists than there are in the entire city of Boston.
If you can lend a helping hand to the people with the greatest need in the world, I think it should be our duty to.
I've seen what hospitals look like in the US and was able to see stark difference in going to public hospitals in Bangladesh and recognizing that I wanted to be a part of the solution.
We began working in the Dominican Republic, which also led us to Haiti, with refugee populations in Jordan.
A number of our global health partners responded immediately to the crisis in Israel and Gaza.
I was in Gaza from November 14th to December 7th.
Med Global just sent a deployment of 5 of us to Gaza.
In resource-limited, austere environments like where MSF works at, it's really important to be sturdy and mobile.
The Butterfly has helped us immensely in the work that we're doing abroad. It's just played a huge role in our diagnostic capacity.
It's not just a device itself and its use that makes a difference, but the form and function in a lot of ways that is also life-saving.
Ukrainians using point-of-care ultrasound on a battlefield, on a primary stabilization point or something, already performing just fast exam. They already saved life.
When 40 wounded soldiers came to our stabilization point, and every hand mattered, and we teach driver to understand where is blood.
Most of them were trauma-related, mass casualties from airstrikes.
Obstetric exams. You also see a lot of extremity pain, so the potential to just pull an ultrasound out and to complete the exam in a matter of minutes to rule out a DVT is also very helpful.
We've seen with a lot of our global health partners that do humanitarian response is that they're actually doing a lot of education.
In Ukraine, the day after we taught our very, very first course, one of the medics had reached out to say they were able to identify a pneumothorax in the field and place a chest tube and save this person's life in a scenario where previously they would not have been able to do that.
The learning is coming not from universities, but from devices, from producers, and it's a huge humanitarian impact.
To date, the Global Health Program at Butterfly has deployed over 4,000 Butterfly devices to 600 partners in 91 countries.
It really just shows the immense capability that ultrasound and Butterfly has in these emergent situations. And it also echoes the need, how great of a need there is for this throughout the world.
Our response to humanitarian crises is at the core what we do and why this innovation was created in the first place, to improve access to healthcare everywhere.